Project BAD is an initiative that seeks to broaden the diversity of downtown. BAD offers a family-friendly environment that encourages interactions, highlighting, promoting, and familiarizing the public with the dynamics of downtown Macon, with the initial event to be held on July 17th. Music by Ladies of Interchange. The 6 festival events will be held every second Saturday through December in the urban core areas and utilize the beautiful green spaces and other downtown venues like Rosa Parks Square, 3rd Street Park, the Tubman Museum, Georgia Sports Hall of Fame, and the Douglas Theater. Project BAD, bringing African Americans downtown.
Hello, everybody out there in radio, internet, TV, and podcast land. I'm Alex Havisham, the host of A Call to Action, which is a show designed to educate, stimulate, and motivate with information that's crucial to the public and to everybody else that would be privy to this information. And of course, it's not about the host, me, it's about the guest. And today is Dr. Patricia Walker. So today is about Dr. Patrice. I had the pleasure of listening to her give a presentation on COVID-19. And one thing that I've been confronted with or curious about is how do you address many of the people and other sources of misinformation regarding COVID-19. Not necessarily to convince anybody, but at least to address all of the so-called, and I hate to say this, but I don't know of a better word, Doc, so-called excuses, some, for not taking it. So in her presentation, Dr. Walker walked through many of the positions that people take regarding not taking the vaccine, all the way to a chip being in your arm to you're growing a tail. I always tell the story about somebody told me that if I were to take that vaccine, I would grow a tail. Well, my immediate response was, well, I'm gonna wag it because I certainly am going to take it. So again, I have with me today Dr. Patricia Walker, who's an OBG. Well, tell us about yourself, Dr. Walker, before we begin the conversation.
Certainly, thank you. And thank you for having me, Mr. Havisham. I always am available whenever you call me. I don't have a problem with that at all. But so I am an OBGYN by training. However, what I don't do that every day. What I do every day is the Chief Medical Officer at Atrium Navicent here in Macon. And that means that I advocate for the physicians and the other credentialed medical staff here, as well as the patients, and make sure that they are getting the highest quality of care that we can give them at Atrium Navicent, and as well as those residents and medical students that come through and get educated. So I do a lot of things, but primarily that's my role.
That is so outstanding. And like I mentioned, you were a part of a program that was held, a few days ago that was entitled All In. And the program was sponsored by the Women in Unity, a group of women who are taking on certain community improvement initiatives and who did a phenomenal job of bringing people together in an effort to get influencers to try to advocate for and educate on the importance of taking the vaccine. But the most important thing, one of them, was your walking through all of the excuses, and you did them one at a time, and you took your time and made the presentation. And I think that's important to the community because it's educational and informational. And I feel like, you know, people make decisions, particularly, and most of us are smart. All of us are smart, one way or another. People who are willing to take documentable information, disseminate it, and then make an informed decision on whatever kind of action they choose to take or not to take. So if you would just kind of walk us through, because I think it's important. I think it's very important that, you know, whatever decisions that I make or you make or other people make are based on reliable information and coming from you with your credentials and your qualifications and your education and your experience, then it seems to me that if it comes for you based on those factors, the information absolutely is reliable. So just kind of go through that presentation, if you would, as it relates to addressing the many reasons that people say, I ain't gonna take it because.
Certainly, I'll be glad to. And to be honest, I have grouped these reasons really into a top 5 list. You know, I can talk for a long time, but most people probably don't want to hear that. So there's really just 5 reasons or categories even of things that we hear most often when people talk about why they have chosen to not get vaccinated. And I like what you said about we're just trying to give people information so that they're making an informed decision. Everybody has a right to do, you know, what they choose for their body and their family, and that's fine. But we just want to make sure that you're making a decision based off of facts and not fear or not fiction. And so that being said, I guess the first reason, and these are not necessarily in any kind of order of most importance, first of all, but the first reason that I hear a lot is that people believe that the vaccines were developed very quickly. They haven't been tested enough, and so they don't have that level of trust regarding how the vaccines were developed. And I would like to, let everyone know that the process for the developing of the vaccines was followed just like every other medication or vaccine that we have out on the market. What is perceived as happening really quickly is based off of the fact that the bulk of the research that went into making these vaccines was actually already happening before there was a pandemic. The family of viruses that the coronavirus is a part of, it's not just one virus, it's a group of viruses. And the researchers were already looking into it. The SIRS and MERS, if you're familiar with that are on the evening news that you hear about every now and then over in other continents, they were basing research off of those other members of the coronavirus family. And so I like to tell people to think about it like building a house. And the framework of the house was really already up. The frame of the house was already up. What we did in 2020 was finish it out. We put up the bricks and the mortar and we put the shingles on the roof, but we did not have to start from scratch. And that's because of the research that was already done. And that allowed us to start from a point where we really could very quickly begin testing on humans. And they tested on a very diverse population of people. There were Black people, there were male and female, and various age groups were included in the testing. And now, millions upon millions of people have received the vaccine with very low numbers of complications, which kind of leads me into the next reason. But whatever your thoughts were about how quickly they developed it, you know, we've had so many people that have it by now. I think I would hope that people would realize how safe it is. But that's the other thing that people, the next reason a lot of people tend to say they're worried about the side effects. And there are short-term side effects and potentially longer-term side effects. And people, you know, name both of those. When you get the shot, there can be some short-term side effects. You'll have a sore arm. You might have a fever or chills or muscle aches. But those things are very short-lasting. You know, you're talking a day or two, and then you're back to your baseline. But people are concerned, well, they have to miss work or what have you. That's a legitimate concern. They're also concerned about the potential long-term side effects. And they feel like, well, we just don't know what those long-term side effects are. And honestly, you know, I have to say at this point, because so many people have had the vaccine, we know we're comfortable with the short-term side effects. There is an unknown component to it. But because of again, the research that has been done and the fact that they base this off of vaccines that, you know, were already in development, I'll put it that way, I feel safe about the fact that these long-term, you know, potential long-term side effects are, you know, are very small. And people, you know, you mentioned microchips and growing a tail and that sort of thing. And, you know, honestly, I just think that that is ridiculous. And during the can't think of the word, the program that I spoke at, you know, our mayor, Lester Miller, also spoke there. And he made a very good point about the fact that people, you know, they don't worry about the cell phone that we all carry, you know, has a microchip that can tell us exactly where we are and when we're there. And, you know, and I thought, well, that's a good point. But, you know, that's what's tracking you. If you want to talk about something tracking your, you know, your every move, that's in your cell phone. You don't have to worry about it being in a shot. How many of us have said something out loud or had a conversation, and then you go on your phone and you open up Google or you open up Facebook and there's ads for something that you were just talking about? You know, I mean, that's the type of society that we're living in. So I think he brought up a good point in the way that we worry about things that we probably, you know, we're already being watched. So there's that. And people are just saying, you know, I just want to see what happens. But again, I just have to go back to the fact that we've had, you know, 50 million people vaccinated, over that amount of people vaccinated. And it is safe. It is safe. The number 3 reason is really worrying about maybe getting COVID from the vaccine. But the type of vaccine that this is really, it's not the type of vaccine that's made off of a what we call a live attenuated virus. That's not how it works. So it's different from something like, you know, the flu vaccine or the chickenpox vaccine. It only thing it does is it presents a protein, a single protein, to your immune system. And it's a protein that's on the outside of the virus. And your immune system recognizes it as foreign. And when it recognizes it as foreign, it mounts a response against it. And that's how it fights it off. So you can't get COVID-19 from the vaccine. It doesn't include it. It's not made up of it. That's not how it works. There's also, so the number 4 reason is that we hear is people are concerned, and this kind of goes back to some of those long-term effects. People are concerned about effects on infertility or pregnancy or breastfeeding. And so if you're of that age group, people are saying, well, I don't know, you know, I don't want it to affect infertility or affect my fertility or pregnancy or breastfeeding. The evidence that we have thus far is showing that it does not affect, you know, fertility. We've had people that have gotten the vaccine and have gotten pregnant after being vaccinated. We have people that are pregnant and have been vaccinated. And of course, I'm an OBGYN, so this is part and parcel of what I do. And while I can't, say, I would request that every woman go to her doctor and get specific information based off of her specific medical, conditions. But so what I'm talking about here is, generally speaking, we feel that this vaccine is safe. And especially for those of you that work in a healthcare setting or a school or anywhere where you're going to come into contact with a lot of people, you have to think about the risks versus the rewards of yourself being vaccinated, in terms of, we think that and recommend that most women of childbearing age should get vaccinated, and should not be concerned about their future fertility, or even pregnancy, or breastfeeding. And in fact, with breastfeeding, what we know is that the whole reason why one of the many reasons why we tell women to breastfeed is that you are able to, as the mother, give your child antibodies against, everything that you have. If you get the flu vaccine, which is again an example of another vaccine that we recommend during pregnancy. We recommend a diphtheria and pertussis, vaccine during pregnancy. And we do that because there's a certain period of time before the baby can get vaccinated. And we all know everybody likes to hold the baby and hug the baby and kiss on the baby. And the baby gets exposed to these infections. But if the mother has antibodies and the mother is breastfeeding, then the baby gets protected through the mother's breast milk. And so that is a sort of additional benefit that could come from women being vaccinated. And we all know that children under the age of 12 can't be vaccinated. So this is something that you can do to protect your baby. And I've really generally recommend it to pregnant women. And I would say the last reason, and a very common reason that we see for people not getting vaccinated, is, I've already had COVID-19. I don't think I need it. I have my own antibodies. I have my own protection. I don't need the vaccine. And first and foremost, I will say that if you have had COVID-19, yes, you do have antibodies, but there's so much that we don't know and understand about how long that natural protection lasts. We know a lot more about the protection that comes from the vaccine. We're still learning in both cases. Let me be clear, we're still learning in both cases, but we know that not everyone responds the same after having a COVID infection. And we know that reinfection does occur. You can have had COVID-19 and you can get it more than once. There have been people that have had it 2 and 3 times.
As a matter of fact, if I may interrupt you quickly, and she said it publicly, so I don't think she would mind my saying it. Erica Woodford, who's the clerk of court, that may not be a title. I know what it is, but she got up and spoke about the fact that she had it once, and lo and behold, she caught it again, and it was really, really devastating, and she was surprised. So, I mean, that was living, tangible proof that one can catch it twice. And while I slipped in on you here, I want to talk a little bit about, the other young man that spoke, who works, the attorney, who works for Attorney MacArthur, who talked about, they call it the long haul. And if you would just discuss that, because once you catch it, and then a lot of people go to 2 weeks or the 3 weeks or what have you to make you think, or maybe you no longer have it, or whatever happens in that process. But there are some residual effects of having had it. So could you just talk about that?
Absolutely, yeah. So long haul COVID syndrome is what happens after you have been infected with COVID. And in many cases, not all, but in many cases, these are individuals that had a relatively mild case. of COVID, or they didn't have to necessarily be hospitalized, that sort of thing. And after the initial, illness completes, these individuals continue to have symptoms over time, months and weeks. And the symptoms can be a broad variety of symptoms, anything from, still fevers off and on. Sometimes some people have, muscle aches. Some people will have gastrointestinal, pain, or things like diarrhea. And also this brain fog where you have a hard time remembering things and thinking clearly, and you just are not functioning at your normal level. And so what we have found is that individuals that are suffering from long haul COVID, when they get vaccinated, many of those symptoms actually go away. So I cannot claim that it is a cure, quote unquote, but what we think is that this sort of a reset happens, that something about the vaccine sort of causes your immune system to reset itself, and all of those long haul COVID symptoms tend to go away. If not go away, get significantly better. And both of the individuals that you spoke about said that's what happened to them after they got that vaccine, that those types of symptoms completely went away.
Okay, there were a couple of instances, and I can't fully, I want to talk about two, and we got just a few minutes left. But are you familiar with that scenario in Florida where this group had caught it? I think maybe 6 people caught it, 8 people caught it, and then, everybody got sick or died. 2 people died, the other people got sick, but there was one person in the group, and he was just had intimate contact with them, who didn't get sick and had no effect from it, and that was the vaccinated person. The one person in the group that was vaccinated, did not catch it. So I thought that was a good indication of how the vaccine really, really works, and that it's important to get it. So very quickly, 2 things in 3 minutes. Number one, what really happened when they said that a group of people in one of the states up north, caught it although they had been vaccinated? Are you familiar with that?
A little bit, and again, I will say research is still being done on how long the vaccine lasts. We think that at some point we will all the people that have been vaccinated may need what we call a booster shot. We just are working out the timing of that. And everyone's immune system is different. And so we cannot say that, it'll last, it might last for 12 months for me, it might last for 8 months for you, but what we do know, however, is that those that are vaccinated are going to have, even if they catch it again or catch it for the first time, they're going to have milder symptoms. It is going to prevent death and, hospitalization and ICU, admission. And that is, at the end of the day, that's the take home message. So again, and you can't guarantee that for someone that is just fighting it off on their own. And I think that's what we have to fall back on, is that the antibody levels that are induced by the vaccine are up to 10 times higher than the antibody levels caused by natural exposure and natural infection. So even if you've had it, if you've had COVID-19, or if you've had the vaccine and you are exposed and you get it, then you're better off having had the vaccine than you are just having the natural infection.
I want to quickly say that the vaccine is readily available. There are so many resources for it. I can immediately think of 3 really top dog solutions, and you can Google them: Scott's Pharmacy, and of course, I'm sure that Atrium Navicent still has it available. And there are a couple of events this weekend, wherein they're called, one is the Freedom Bash, and something has to do over at Little Rock Baptist Church, or Welcome to the Neighborhood. So there are entities and individuals and organizations that are really trying hard. The Women in Unity all in, so there, if in fact one is interested in getting a vaccine, then there's all kind of resources for that. And you could talk about the one at Navicent.
Yeah, so I will say at Navicent, we are transitioning away from our mass vaccination sites to more targeted events like what you're talking about, people in the community or not-for-profits out in the community that want to host an event. We're available to come to their event and to do vaccinations. We've worked with churches and other various, organizations. So that's what we're moving towards, because we've had such a drop off at our mass events or our mass locations. So it's not that we're not doing it, but we're just trying to target and focus where we know a lot of people are going to be, as opposed to waiting for a handful of people to come to us. But don't forget about the health department as well. We have a beautiful new health department. They just moved from Gray Highway to over here on Forsyth Road as you're heading towards the hospital. They have vaccines there as well.
Thank you so much. This is a call to action. I have those 30 minutes really went fast, girl. You've done such a phenomenal job as it relates to eliminating the excuses. And those of you who hear this and you have friends, relatives, and neighbors who may have some doubt, then I want you to be able to share this information with them. It'll be on my website at www.makingcalltoaction.com and on makingblackpages.com and on Alex Habersham, YouTube and podcasts everywhere. I want the information shared to the community, so anybody who makes a decision will make an informed decision based on evidence and research and education. I have had Dr. Patricia Walker of Atrium Navicent Health, who's the the Chief Medical Officer. Chief Medical Officer for Navicent Health. I appreciate you. I appreciate your willingness. I appreciate your enthusiasm. But most importantly, I appreciate you addressing those excuses. This is a call to action. I'm your host, Alex Habersham. Having interviewed Dr. Patricia Walker. Have a great day.
www.makingblackpages.com.
Get ready, Central Georgia. Project Bad starts this summer. Making Black Pages, Newtown Macon, and Rhythm and Jazz Foundation will host 6 multicultural events in downtown Macon. Project Bad is an initiative that seeks to broaden the diversity of downtown. BAD offers a family-friendly environment that encourages interactions, highlighting, promoting, and familiarizing the public with the dynamics of downtown Macon, with the initial event to be held on July 17th. Music by Ladies of Interchange. The 6 festival events will be held every second Saturday through December in the urban core areas and utilize the beautiful green spaces and other downtown venues like Rosa Parks Square, 3rd Street Park, the Tubman Museum, Georgia Sports Hall of Fame, and the Douglas Theater. Project Bad, bringing African Americans downtown.